Okay, and welcome everybody to Transformational Tuesdays. I'm Teresa Velardi, your host for this time of inspiration, education, motivation, and conversation that we focus on key ingredients necessary for transformation that are positive changes in our lives. So I want to welcome everybody, first of all, and let you know that if you are hearing the sound of my voice or seeing my face, you already are in a process of transformation. Otherwise, we wouldn't be together. You recognize that you are, because one thing that is for sure that is life is always changing, always changing. So for our time together, we're going to be sharing lots of ways in which you can transform your life in so many different areas: physical, emotional, relational, spiritual, financial, career. And Dr. Dolores is here to speak to us about her expertise, which has to do with your physical well-being and your physical transformation. And we're going to be talking about recovering healthcare, which really we're going to focus today on having successful surgery. So before I get started with this conversation with Dr. Dolores, let's introduce her first of all. So Dr. Dolores Fazzino is a doctor of nursing practice. She's a nurse practitioner, an author, and she's a distinguished pioneer in visionary bridging the world of spirituality and wellness. Her company, Recovering Healthcare, breathes new life into patient wellness through education, empowerment, compassion, and connection, and prepares patients for successful surgery. With over 38 years of nursing experience and having assisted in approximately 9,000 surgery, she knows what works to create positive outcome for patients undergoing surgery. She's been gifted since she was a child with intuitive abilities, and she's always been on the quote-unquote cutting edge, no pun intended, with the surgical thing. She's worked under revolutionary Dr. Bernie Siegel, an international expert and surgeon in the field of cancer treatment and complementary holistic medicine. And trusted as a surgeon's right hand on complex procedures, Dr. Dolores has worked in specialties of neurosurgery, orthopedics, urology, and gynecology using minimally invasive and robotic techniques. Always a visionary, she founded the Concierge Surgical Coaching Program to offer enhanced preparations to patients prior to surgery, employing complementary and alternative therapies. This kind of preparation is now commonly accepted as an adjunct to the traditional surgical preparation today. Dolores trained at Yale New Haven University Hospital and Children's Hospital in Philadelphia. She earned a doctorate of nursing practitioner degree in 2008 from Case Western Reserve University, one of the top nursing programs in the nation. And on the cutting edge, again, Dolores now takes us beyond the body-mind paradigm to include spirituality in wellness and health and personal physical wellness. Her books, How Do I Get the Most Out of My Healthcare Experience, is a must-have resource book to assist people to maneuver through the healthcare system. And Spiritual Wellness for Life shares stories about those aha moments that can change your life forever. They're available on her website, recoveringhealthcare.com/books. Welcome, Dr. Dolores Fazzino. How are things in San Diego today?
They're just overcast and cloudy, but thank you, Teresa, for that wonderful welcome. And it's a pleasure and an honor to be here today. And I'm just very excited. There's a lot.
I always love having you on Transformational Tuesdays. You always bring an incredibly insightful conversation to the table for our listeners. So I'm so grateful and honored to have you here.
Thank you.
You're welcome. So this is something that most people don't pay attention to, that we're going to talk about. But tell us a little bit more about your background and what led you to creating Recovering Healthcare.
Well, like you were sharing, I've been a pioneer most of my nursing career. I'm the type of person that when people say, think outside the box doesn't exist for me. Meaning that I've always had a very broad, my universe is like very broad. And so for me, I'm able to see the bigger picture of things and how things are kind of aligned instead of having blinders on. So for me, I had been in an entrepreneurial career for the last 22 years of my nursing career as an assistant surgeon. So just to clarify that with people, I'm not an MD, a medical doctor. I'm a nurse practitioner, but as a nurse practitioner, I have gained a skill set that allows me to step in as an assistant surgeon to assist on surgeries. So I had been doing that for numerous years, and as we all know, that there's been so many changes in healthcare, and for people like myself who are nurse practitioners, physician's assistants, we're pretty much in the same category. It's been more and more challenging to get reimbursed from insurance companies, because that's how we get reimbursed. And in fact, it got to the point where it was just almost impossible. Here you are doing the work first, and then they're determining whether or not they're going to pay you, first of all, and if they are going to pay you, you're going to have to fight tooth and nail to get it. The sad thing is, it's like it's very resembles indentured servitude, which unfortunately I am not really. I had enough of that. I believe that I've learned lessons from that, and I'm done. So I knew with all the changes that were coming down the line and what I could see, that it was time to get out. And you know, that little voice that sometimes talks to you and says, you know, it's time to leave, it's time to leave, but you know, sometimes you ignore it. Mm-hmm. Well, I've learned over my lifetime that when that voice talks, it's got to be like E.F. Hutton, you need to listen. Because I have learned that when I don't listen to that voice, I live to regret it later. So I ended up leaving a career that I created for the last 22 years on a big leap of faith, because I really didn't have anything else set up, but I knew that if I had stayed in that career, I probably would have gotten sick. Because, and that's another topic of conversation, because when you're under mild stress, your body is constantly putting out cortisol, and cortisol has a lot to do with inflammation throughout your body. Mm-hmm. So I decided that I was going to do this on my terms. So I ended up contacting the people that I needed to contact, and long story short, last June 8th was my last day of that career. So no, yeah, I know, I was jumping up and down too. Mm-hmm. In fact, my body loved it so much that it immediately in 3 months dropped 30 pounds, because wow. It was the stress, okay, the cortisol level. I didn't change my diet, I didn't change my activity level. It just came off. Because what I want to share with people is how many times we're in situations or jobs that we're not really sure that we like it anymore. There's a lot of stress, but it's just like you're in constant stress, where it's just like your body's just humming just above normal, you know, to accommodate that stress, but we don't really realize the impact that it has on our physical bodies. So long story short, I left last June, and I was working with a business coach, and she said, so now what are you going to do? And I'm like, I'm not really sure. And so we were talking about possibilities of things, and you know, what I'm really passionate about is that healthcare is so broken right now. And being in it close to 40 years, I've seen a lot of changes, and I've seen a lot of gaps in healthcare where there's opportunity to create something to bridge the gap from where people are to where they could go. And one of the things that I really found that was an issue was how patients are prepared for surgery. Being in the surgical realm for the last 30 years of my nursing career, and being in, you know, as an assistant surgeon, I got to witness a lot of things, a lot of ways how people come into surgery and how the outcomes go. Also, you know, what their behavior patterns are or their personal habits are, and how they do after surgery. And I realized that there is much more to that picture. And to my liking, I've also realized too that there had been research that started to be conducted in the realms of that, like the effect of complementary and alternative modalities like music therapy or guided imagery. And basically what it was, it boils down to the person's attitude, but also their anxiety level and their stress level that really contribute to whether or not they have a successful surgery versus a not successful surgery.
Yeah, and let's talk a little bit about that. One of the things you talked about, there's being so many changes in healthcare and how broken it is. What have you seen that, before we get into your preparing people for successful surgery, what do you think have you seen has been the most crucial change, besides the fact that the practitioners are not paid really well, paid according to schedule or paid according to financial guidelines? Do you think is the most crucial change in healthcare today?
I think what the most crucial thing is that, humanity is this beautiful fruit salad. We're all individuals. If you could imagine every fruit in the universe in this beautiful fruit salad, and then all of a sudden Western medicine wants to change that beautiful, luscious fruit salad into an apple. I think that kind of surmises the whole thing. What Western medicine I have found is that they're always wanting to standardize things to make it easier for the practitioner. So it's like they have a standardized procedure, the checklist, this. They're trying to fit everybody into that checklist, but you can't, because each person is an individual. What's going to work for you, Teresa, maybe something completely different that's going to work for maybe Cheryl, who's on the phone call, or myself. And Western medicine doesn't take that into consideration.
Right. So really what you're saying is that the patient actually gets lost in what is created by a standard in Western medicine philosophy.
Agreed.
Okay.
Very much so.
Yeah, and so you have, with the work that you have done, both through being actually in the operating room and what you've done with Spiritual Wellness for Life, and now this recovering healthcare, you have focused on the patient.
Oh,
completely.
Absolutely. It is about the patient.
Right.
Unfortunately, insurance industry has really done a job with healthcare. And that's another discussion. Mm-hmm. We're not going to talk about that here, but I just want to talk about it on the fringes, is that there's so much regulation that has gone down, not only through the insurance companies, but also on the federal level as well. Mm. And, we have the state and federally funded things like the Medicaids in each state, but also Medicare. Mm. There's regulations that have been created, and they are actually so stringent that if the healthcare provider does not do them, that affects their reimbursement. Or if, and this goes back to the analogy of like changing that whole fruit salad into an apple. Just for an example, if you have a patient that comes in that, for example, might be a diabetic, they're at a very high risk for getting an infection just because of the disease. Right. But it's the practitioner's responsibility to make sure they don't get an infection while they're having surgery. Well, we have no control over that. Do you understand what I'm saying? Because the person comes in as they are, and in a perfect world, that would be one thing, but you have people with all different themes and variations of, and people who have taken well care of themselves and other people who have not. People right. who have, maybe been drinking and have problems with dependency issues, or they might have, poor health where they have, heart condition or a lung condition or even diabetes or, thyroid, anything that they have. This isn't really taken into consideration, but it's a blanket statement. So it's almost as if we're not allowing patients to take accountability for their own health and wellness anymore. Right.
And so one of the things that you do, I'm assuming, and you're going to tell me right now, but I would imagine, because I know your level of integrity, is you will have that conversation with the patient about what is behind the scene that the doctor does not know because you have not disclosed, and how that is going to affect them undergoing the surgery. So tell us more, tell us something about how you utilize this, your philosophies, your skills and talents, and helping people to actually get prepared for surgery. And all of what you just said is part of the conversation that maybe the doctor doesn't know because the patient has chosen not to disclose. Yet you come from a standpoint of solely being an advocate for the patient and can help them get through it. That's what I'm hearing. So let's talk about all of this that you bring to the table today.
Well, Teresa, I just want to clarify one thing. I am not their advocate. I empower people to become their own advocates.
Better words. Thank you.
You're welcome.
Yes.
Because I can't do it for them. They
Right.
need to do it for themselves. And I hold people highly capable of doing that. In fact, when my parents were alive, I live here in California, they were living in Florida. And they were, in their late 70s, and they were very capable of making the decisions that they need to make. I would empower, coach them from a distance and give recommendations and suggestions. Like, have you considered doing X, Y, and Z? What are your thoughts about doing, A, B, and C? And I would empower, coach them, and just give them the power, because oftentimes in our healthcare system, especially our parents and our grandparents' generation, they've given their power away to the doctor as if they had all the answers. And in no disrespect or anything, they do not have all the answers. And after being in this realm for close to 40 years, I've witnessed this. And I believe that the younger generation of physicians are more on board with this and realizing they don't have the answers, which is fine. What's most important is that you want to partner with somebody who's going to be like in a partnership with you. I want to call it, when you go to find your doctor, you really should be interviewing them, and just as if you were dating somebody. Find out, okay, is this going to work together or not? Are you going to be supportive of what my thoughts are, or are you going to tell me what to do all the time and not allow me to have any input? It's really important for people, when they take ownership of their health and wellness, is to be their own advocate, because you have lived in your physical body your entire life. Nobody knows your body like you do. That little voice that talks to you, listen to it. It's never wrong. Mm-hmm. Even though the doctor might be telling you something else, if you're getting red flag, it's like a notice. You put on alert, pay attention, because this may not be the right thing for you. And it's, believe me, I give you permission to ask questions and even to counter what they're saying. Mm-hmm. A lot of times people shy away from that because for whatever reasons that, they feel like it's disrespectful. It's not. You should have a relationship with your healthcare practitioner as if they were part of your business team, if you're in business. Or, yeah, exactly. So, even myself as a healthcare practitioner, when I go in to have my checks and go to the doctor and stuff, I, come right up to the table and I say, well, this is what I'm thinking and this is what I'm wanting to do, and what are your thoughts on that? And they may agree and may disagree, and I have fired several people, and I have no problem with that, because if they're not going to listen to me and take what I have to say seriously, I don't think there's no trust there. Why would you want to hand over your power to them in one of the most vulnerable states that you're going to be in, God forbid, if you ever have surgery? It's about building a trust and having a trustful relationship and being in partnership with somebody who's going to maneuver you through your health care throughout your life. Yeah.
And, I think that especially people who are moving on in years, I think that the title of doctor for a lot of people is very intimidating. Like, they should know it all, and no matter what they're feeling in that gut, as you have said a couple of times now, and I'm going to reiterate that, pay attention to your gut. What that little voice that comes to you and says, pay attention, or maybe don't do this. Explore what other possibilities there are, because it will always lead you in the right direction. And I think that a lot of people, especially the aging population, as I said, in this country, they think that because somebody has a designation of doctor, that they know it all. And as you just said, they don't. They don't. So why is it important? One of the things that I know for myself, I've had surgery several times, and one of the things I know for myself is that there's nervousness, there's anxiety, there's fear, there's stress. How do those things, as you are getting ready to have surgery, play into what actually happens to you on the operating table? And how can you prepare people to avoid those things to have a more successful experience?
Well, I'm going to go back to the research a little bit to talk about this, because we know that when we're stressed out, it really, we talk about cortisol in our bodies. The cortisol level rises, but cortisol is, as you remember, it's for fight or flight. Mm-hmm. Fight or flight and, the calmness. So in our society, we're constantly running on adrenaline. It might be on a continuum of very little to a lot. When you have surgery, there's a lot more adrenaline going on. So if we look at it from this aspect, because it's like the fear of the unknown, it's like, oh my gosh, what's going to happen? It's like you're going to be in the most vulnerable state where you're basically you're losing control, because you're being anesthetized and you're going to have no control over what's going to happen. Mm-hmm. So that kind of plays into it as well. But it's a lot of times about our beliefs about things too. That plays, there's evidence-based research in regards to our beliefs, but also our anxiety and stress and the outcomes on surgery. When we have anxiety and stress, a lot of times we create more pain for ourselves post-operatively, because when you're under stress, you're constricted. And when, you have to have surgery, that's an insult to your body. So if it's already stressed like that, it's even more, there's even more possibilities of having more pain because of the constrictedness. When you're completely relaxed and your mind's at ease, that cortisol level goes down and you're just perfectly calm and relaxed. What I am going to tell you is that it's absolutely normal to feel stressed out and have anxiety around surgery. When people don't have that, that's when I worry. Mm-hmm. Because that's more of the normal thing. Now, when people get prepared for surgery, if they're starting to implement complementary and alternative modalities in with being prepared on a physical level, what I want to reiterate is that the physicians and surgeons are excellent at doing the physical aspects. I've worked with some of the best technicians and surgically gifted surgeons that I've had, in the San Diego area, and they're truly masters of their craft. What they're not really good at is dealing with the emotional, mental, and spiritual issues that are part of the physical.
It's all integrated.
It is. It's not compartmentalized in boxes. People have a tendency to think that, okay, I could separate this and it's going to be, one thing. What I'm going to share with you just for an example is like when people come and have bariatric surgery, okay, the weight loss surgery for the morbidly obese people, mm-hmm. is that a lot of times there are other issues going on besides the physical stuff. The physical stuff is the end product of all the emotional, mental, and spiritual stuff mm-hmm. that has, they have created this situation for themselves, okay? And I'm going to just give that as an example. So they have the surgery and they are successful probably for about a year or so, and they lose a lot of weight. Then all of a sudden, there's like a 20% failure rate with that surgery where they gain back the weight and then some, believe it or not. And when you look at that, yes, there are programs set up that deal with the mental and emotional aspects, but sometimes we don't get down to the core issue of what was really driving the need to eat, but also the need to, accumulate a lot of weight on their bodies, which a lot of times is a protection thing.
Yeah.
It's like you put on weight so you could emotionally protect your physical body, but what you're really doing is protecting your emotional and mental aspects and trying to control that and keep it at bay.
Right.
So what I have found is that some people have not addressed the underlying issue that contributed to actually creating that issue and that need for having the surgery. So when people start looking at things a little deeper on a deeper level, they usually do a lot better.
Mm-hmm.
And they have more control of their lives, because a lot of times those things are more on an unconscious level that are creating their reality. And sometimes all is needed is just to get that unconscious piece into consciousness, and it heals.
Yeah.
And it shifts that quick.
Yeah,
That's
so important. I mean, I know a lot of people who have gone through that procedure, and I know people who have been able to work with the issues that were underlying and have been successful in keeping the weight off. And then I also know a couple of people who are bigger than they were before they went in. So, but what I want to point out here is something that you said earlier. When you let go of the stress of the job that you didn't want to have anymore, your body automatically adjusted itself when you lost the 30 pounds, because your cortisol levels had shifted. And so your body actually just released with ease the excess weight you were carrying on because of the stress that you had imposed upon yourself for the work that you were doing, and you knew you needed to move into something else. So that right there is proof positive that everything is integrated. And so I know that what you do to prepare people for successful surgery speaks to all of these points. And I just want to point out that it is almost 12:30, and I want to invite our listeners, if you have a question and you're watching from your computer, just type in your name to the on the chat box and let me know, and I can unmute you to ask your question. If you are calling in and are not using the Zoom app and cannot do what I just said, you can dial this number, 570, not dial, text this number, 570-230-4185, and I will recognize you and unmute your line so that you can ask Dolores your question or give your comment. So I invite you to participate, because this is really important. If it's not you who's getting ready to undergo surgery, there may be someone in your life now or in the future who you can speak to, who will be able to benefit from what Dr. Dolores does. So let's talk about some of the things that you do, and are you able to work with someone who is not physically in front of you, and if so, how?
That's a good question, and yes, I can. My practice is what we call virtual, so just like we are online right now, this is how I would do this type of interaction, but also through Skype and through phone. Mm-hmm. I have clients internationally. I also am able to be on site for people if that's something they desire as well. Now, what I wanted to back up one thing and add something that I feel is really important. Surgery is like, for some people, is a crisis in their life. And what I teach people are tools to allow them to maneuver through that crisis, but they could be transferred over to use in any crisis that they're experiencing in their lives. It's not just geared towards surgery, because remember, everything is interconnected. It just so happens that surgery is like the pinnacle for this particular person, that maybe they need to look at the way they do their life. And by bringing some understanding to what's going on, this will give them more insight in order to make some changes in other parts of their lives. Because like I was saying, nothing's in a linear progression. It's not A plus B equals C. It's like the whole alphabet's together and it's inner matrix together. So you could have 3 different things on the surface, and you would think there's no way that these things are related.
Okay, like, all right, I lost my job, or, and, my animal's sick, and, my husband, doesn't like me, or whatever. And when you matrix this down, it might be one core belief, but you're getting themes and variations of the same core belief. It might be something about abandonment. You know what I'm saying? When you boil it down to one thing. So that's the most amazing thing about the work that I do here through Recovering Healthcare, because it really empowers people to dig deeper within themselves, but also to create something different for their future. So they're actually starting their transformational journey because of that surgery.
And I think surgery does create an aspect of, as you just said, creating a transformational journey. I know for myself, I had a hysterectomy, and when a woman has a hysterectomy, the first thing it does is it screws up your hormonal balance. It absolutely does. And although I practice techniques that would help me to stay calm, matter of fact, I remember my friend Evie took me to the hospital, and she said to me, "You don't look like you're nervous at all." I was very secure in my relationship with the doctor. I had asked all the questions. He had given me all the answers that I needed and felt comfortable. I practice meditation. I do inner work. I prayer, meditation, being able to calm myself beforehand. She says to me, "I can't believe you're not nervous." And then they gave me an injection of something to calm me down. And I was like a ball of Jello in that bed. I was still waiting to be taken in. But, everything that you have that's going on. And I have a comment here from Karen who says, "When I read my late husband's autopsy report, I could tell by reading that the kind of life that he lived." So our body holds everything.
Yes, it does. And it holds everything. And I want to elaborate on that as well. Those times where we've been really angry at somebody and we internalize that instead of saying what was expressing our feelings, or those times that we, were so angry we would never forgive somebody, that energy's there, it's unexpressed. And technically, it never hurts the other person, it always hurts ourselves. And there is research out there now, which we always knew this was true way before that the act of forgiveness actually helps your health. No kidding. I have to laugh because some doctor's famous for this now, and it's something everybody has known forever.
Yes.
But, that's just the way healthcare is.
Yeah. Well, the thing is that a lot of people, yes, everyone who is in that conversation knows, but there are a lot of people who absolutely don't know. They point fingers at everybody, they make everybody else responsible, take no responsibility for themselves, and then they wonder why they end up in the situation that they're in and feeling as badly as they do and ending up on a surgical gurney in the first place. And then whatever comes after that is only amplified by the stuff that they have experienced and brought in, all the unforgiveness and everything. So,
well, and I just want to share another story with you. I remember probably halfway through my career, I work with a lot of different surgeons, of course, and we were doing a mastectomy for a woman who was diagnosed with cancer. And I shared with the surgeon, I said, it's really too bad that what we're doing here is more of a Band-Aid technique, because unless we address the underlying issue of what really created the need to have breast cancer, she's going to be back. And sure enough, she was back. So I've witnessed that as well, that when we just look at the physical stuff and think we could cut it out, that's like being an ostrich with your head in the sand, because there's way more going on. The physical part is just one part of the mental, emotional, and spiritual aspects. And like I said, they're all interconnected, like a matrix. So
Yeah, that makes perfect sense to me. So Todd, I'm sure that little bits and pieces of this, you're just giving us little bits and pieces of what's actually in your book. Let's talk about more about the book and what inspired you to write that book.
Well, I have a copy of it right here, so I'm going to just, if everybody could see that.
Yes.
It's a help book. And so this little book is written for, I call it the layperson. It's written for people like my parents. And when my parents were alive, as I was saying, I would empower coach them from a distance. I love my parents dearly, but it wasn't my job to pick up and just go to Florida and rescue them. That I don't do that. They're perfectly capable of doing things. And I figured, okay, this is a good thing. So they passed away 4 or 5 years ago. And recently I thought about all the things that I used to share with them. And they were really fortunate because they had somebody in the healthcare profession within their family. And it was challenging for them, even with that. I was just thought about the population of people who have nobody in healthcare in their family. It's like they're sitting ducks. And plus, healthcare is changing so much that even healthcare practitioners are having challenges maneuvering through the healthcare system. So I wrote this book in mind with those people. So I talk about from the time that you first get diagnosed, like, okay, now what? How do I pick out my doctor? And I talk about interviewing them and, what's important to look for and, educating yourself, but also how to get your documents in order, because what I want to share with people is that, yes, you go to the doctor and they spend very little time with you, and it's not because the doctor doesn't want to spend time with you. You have to understand with all the regulations that have gone on and how the insurance pays, but also if they're part of a hospital doctors group or a private doctors group, their time is limited. So the best thing people could do is be extremely organized when they go in, so they get the most, I call it, bang for their buck. So it's up to you to be organized, even with the questions you want to ask, because how many times we've gone to the doctor and it's just like you have all these questions, you don't write them down, you get there and you're like, blank face,
Right.
like, oh, I forgot. And then after you leave, you have all these questions. So I invite people to be proactive and take care of those things. I also talk about healthcare insurance. I also talk about when people don't have it and how they could get healthcare, but also if you get a hospital bill and you can't pay it, or any type of bill, what you could do in order to maybe get it paid or to work with the institutions and stuff like that. Those are important things because those hinder people from seeking out healthcare, which it's really sad, because what I've seen and what I know is that if people are sick, they hold off to the last moment possible, because either they don't have insurance, or if they do have insurance, they have a high deductible and they can't afford to pay the deductible. And they wait till the last minute, and then they end up in the emergency room where it's going to cost them buku bucks, way more than if they took care of it and addressed it initially. And that's not a really pretty picture, because a lot of times when people come into the emergency department and they're that sick, if they had needed to have a surgery that was put off, and, a classic example is somebody who's had problems with their gallbladder, and they end up having, they've known they had a history of that, and they wait till it's really, really bad. A lot of times it's so infected that it puts you at a higher risk of having a surgery.
Right.
So there's way more complications that happen. And so, you really want to be proactive, and your health should be a priority, and it shouldn't be dependent upon whether you can pay your insurance or you have insurance or not. Because folks, let me tell you, if you are not on Medicare or Medi-Cal or an HMO, and you do have insurance and you have a deductible, you are really paying cash out of pocket for your health care.
Yeah.
Bottom line. You pay a monthly fee to join the insurance club, and then you might have a high deductible of like $5,000, $10,000, $15,000 a year. Okay, there's no guarantee that when you go to see Dr. Smith for whatever thing and his bill comes back $1,000, you would automatically think you could put that $1,000 towards your deductible. Oh, no, 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 no. The insurance company deems how much of that goes towards your deductible.
Yeah.
It might be a third to 50% of that. So you're paying towards your deductible, but you're also paying cash out of pocket too, because you have to pay the balance to the doctor.
Right.
It's going to take you even longer to meet your deductible. So people at the end of the year probably don't meet their deductible. So they're never reaping the benefits of having insurance, not unless there's something catastrophic that happens.
Yeah.
However, the thing is that people think they have insurance, but they don't.
Well, here's something else that's a really great question in relation to doctors and healthcare. And Dawn, I just opened your line for you. So you want to ask Dolores your question?
Sure. Dolores, can you hear me okay?
Yes, I can, Dawn. Go ahead.
Okay, great. I have a brother who is 52 years old and has been in and out of the hospital within the last probably 5 years, almost 8, 9 times. So It's been a very challenging road for my mom and I, and everything that you've been saying today really resonates with me. So the question that I had was, we have a really difficult time getting the various doctors, because he's treated by so many different doctors for different things, just trying to get them to the table to have a conversation and to stop everyone prescribing more drugs. I mean, he takes almost 25 different kinds of medication.
Oh, dear God.
Exactly.
Yeah.
And so I was successful with a healthcare advocate at the hospital here in Rochester to get his primary care physician on a cell phone and his surgeon in basically a coat closet where we conference called on a cell phone.
Okay.
And it was just pathetic. I've just in my life never seen anything so pathetic. And they seemed willing to meet, but they couldn't make time to get into a room that was of any sort of, I mean, literally they had to move things out of the closet so we could sit down.
Oh my God.
So, yeah. And I don't know if you have an answer for this. I guess I'm looking for, is there any group or organization that can somehow get your doctors all into a room, because every one of them prescribes their own thing. You know, they're not looking at the whole picture.
I agree. And you know what? That is a very, very common thing. Dawn, thank you for sharing that. Polypharmacy is like a big problem that creates more and more problems for people than looking. It's like slapping Band-Aids on. Have you ever been to like a fair, the county fair or something, and they have this little game called the whack-a-mole, where the mole pops up, whack it, and it pops up there? This is the analogy that I give. People in healthcare are in react mode. They think, instead of looking at the underlying issue to what's contributing to the problem, throwing another med is the solution. Now, okay, so your brother is on way too many meds. You and I both know that.
Yep.
So what is going to probably need to happen is that, how's his nutrition?
It's day to day, it's good. It's when we get together and do any kind of family things, he goes off the rails a little bit. So he's got type 2 diabetes. He's had open heart surgery, and not because he had any heart issues. They missed a blood clot in his leg and it traveled to his heart and burst.
Oh dear.
So, just the treatment of things that are coming about as a result of these. He has high cholesterol, high blood pressure.
Yeah. Well, what I'm going to tell you.
And they're treating him for all kinds of stuff. So bipolar depression is mixed in there.
Yeah. So the thing is that he is like a walking pharmacy right now. And so, of course, Big Pharma loves that, because they're constantly,
they sure do.
And that's the problem. It's like, okay, these meds, somebody needs to sit down and find out what's making sure that some of that stuff isn't counterindicated with other meds. Has anybody ever done that?
Well, I took the list of things over to the pharmacy because they seem to understand it better. But my brother is also very he's very protective of those meds. You mentioned earlier about people who have difficulty, you know, keeping weight off after the gastric bypass. It's a similar type of thing. He's so used to these things that even when I ask the doctors or inquire about it, he gets upset with me for inquiring. He wants me just leave it alone and let them handle it.
Well,
and I'm like, you realize that they're going to kill you. I mean, these things are going to kill you. We're not meant to have all this fake stuff put into our systems.
Well, the thing too is that this is another issue that needs to be addressed, is like, does he want to change? Because that's the bottom line. You know, a lot of times, Don, we think we have people's best interest in hand, but it's like the old expression, you can lead a horse to water, but you can't make him drink. Absolutely. First of all, a person really needs to want to change. And our good intentions, even though it's so painful for us to watch, we have to realize this is their life and their journey. We could offer suggestions, but if they're not going to take it, it's not our responsibility to make it better for them. Okay?
Yeah.
And so, I mean, that's
honestly, I don't think he does want, I mean, he wants the pain to go away, but I don't think he wants to really change all the behaviors that are underlying.
It's exactly. So until, you know, he gets that, or even, you know, you could do the drip factor and keep putting it, you know, in his environment. Maybe eventually it'll shift. But, you know, in all honesty, you can make changes and stuff like that. I think it's a double-edged sword too. Okay, I'm going to say that too, because with what you just shared with me too, he's got, you know, maybe some bipolar stuff going on. So there's a fine line between making changes and involving him, but also doing what's in for his best interest as well. So he's able to make all his own healthcare decisions. Is that correct?
Well, my mom is his power of attorney, so she really makes a lot of those decisions for him.
Okay. All right. So
and because of the heart issue, we lost some brain functioning there in that whole process because they had to resuscitate him, and so he's not fully. You know, the doctors have told us. He said he's 52, but you need to not look at it like you think of 52.
Right.
He's really like an 85, 88-year-old man.
In that case, what I'm going to suggest is this: start looking at his diet. Okay. And is he eating a lot of processed foods?
No, again, mostly during the week. He lives with my mom, so no, she makes sure that he's eating pretty healthy, 3 meals a day. It's just on, you know, weekends or if we do family gathering, like Memorial Day, we ate a lot of junk. So.
Well, that's okay. I mean, you have to have, you know, stuff like that. But what I'm saying is have him look at his diet, because there are things that you probably could do that are probably you're not doing as well. Sometimes we think a healthy diet is one thing, but in essence, there's other tweaks that you could do with that. And also look at some of the supplements that he's taking. Is he taking any supplements at all?
I don't believe so.
Yeah, because he probably nutritionally is not getting the nutrients he needs. And a lot of times the nutrients that we lack in our bodies, like vitamin D3 is a big deal. A lot of times people don't have enough of that in their systems, because if you go outside and you're in the sunlight, you get a lot of the vitamin D. And we don't spend a lot of time outdoors anymore because of, you know, the cancer scare. So a lot of people are lathering up with, you know, UV protection of 30, 50 or whatever, or they're not out in the sun. So you're not getting, you know, the sun that helps with the vitamin D. So, and what they've found too is vitamin D is very good for reducing inflammation in people's bodies as well. So my sense is that
Did you say D3?
D as in David 3.
Yeah, and you know, I was having a conversation with somebody yesterday about this exactly, and I hope that Dolores has answered your questions, Dawn. I'm going to mute you so that we can move on to someone else too. But this, I hope she's answered your questions. But I was actually talking to someone yesterday who was diagnosed with MS, and the doctor checked her D3 levels. And I read it on the internet myself yesterday. D3, a lack in vitamin D3 is one of the things that sparks multiple sclerosis. So it's really important. It also, I've discovered it will also, lack of vitamin D3 will also help, will also keep your body from releasing excess weight. It's got a lot of different things, as Dolores just said. So tons of information, Dr. Dolores. Do you offer a webinar where people can tap into that brain a little bit more deeply with what you offer to them?
I do. And, you know, if people are having surgery or they know if somebody's having surgery, I offer a free webinar. And I actually have Teresa. I'm going to hold this up. I don't think you could see it. Can you?
Down a little bit. Yeah.
Okay.
Okay.
There's a link there, and I'll read it to you as well.
Okay.
Okay. It's called recoveringhealthcare.com/free-webinar / and you can find this on my website, recoveringhealthcare.com. I offer a monthly free webinar. It's informational about the things you need to do in order to prepare for a successful surgery. And when you sign up for that, you get a free checklist for a successful surgery. And I put together a list of things that are really important, like what questions to ask, like getting your legal house in order, because let's face it, there's a lot of unknowns with surgery, and I don't say this to scare anybody, but I'm a realist, is that any type of surgery you have, there's a risk that, you know, you could have complications, you could die. I've known people who've gone in for very simple things, you know, they're perfectly healthy and weird stuff happens and they died. So getting your legal house in order is really important, but also thinking about what you're going to need after surgery, before surgery is the time to get that all set up. You know, there's things that happen after surgery that you probably might not know about, or maybe when you had your pre-surgery visit at the hospital or with your doctor, they just forgot to disclose. But these things are important, and they might be little piddly things or little minute things, but they make a huge difference.
And it's empowering the patient to do
Exactly.
what they can do to take care of themselves, their families, their finances, all of the things that are necessary. So that's powerful information. So recoveringhealthcare.com/free-webinar / twice. So awesome. And once a month you give these free webinars?
I do.
Okay, and do you offer coaching, individual coaching for people?
I do offer individual and group coaching. I offer a 6-session group coaching program where we talk about more in detail of what to do before, during, and after surgery. There's an hour set aside for each aspect, and it's sandwiched in between with an hour for questions and answers. People have specific things. It's recorded, the first 3 hours of the pre, during, and post, but the questions and answers are not, because of HIPAA, it's privacy, the Privacy Act and HIPAA, so we don't record that part of it.
Right. So you offer the information, you give opportunity for question and answer, so anyone who participates can have the opportunity to not only learn what you offer as a standard, but they can personalize it to themselves by asking powerful questions. Yes.
Exactly.
Okay, good. So how can the people who are listening today or who will listen to this replay, how can they get in touch with you?
You could either go to my website or you could contact me. I'm going to give you my my phone. It's 760-579-2440.
I just put it in the chat. 760-579-2440.
Yes.
That's the direct line to you. recoveringhealthcare.com, and the email address
is info@recoveringhealthcare.com.
Okay. Any last words before we close? We have 4 minutes left.
Well, I thank people for coming and listening, and I hope I gave some insight into why it's important to really be prepared for your surgery and your health and wellness and be your own advocate. And just know that anything is possible. And I just want to say too that miracles happen every day. I witness them.
Every day. I'm going to unmute the lines. If anybody has a last question, speak up, and we can address your question. All the lines are unmuted. If you have something you'd like to say, comment, question for Dr. Dolores before we close in the next few minutes, this is your opportunity. Take advantage of it.
This is Sylvia.
Hi, Sylvia.
Good afternoon. Hi, I just wanted to say I just wanted to say thank you. I just caught the last few minutes, but it was very helpful. I'm going to be scheduled for surgery here in the next 30 days, so this was extremely helpful.
Oh, good. I'm glad to know that. Good luck.
Awesome.
Thank you very much.
You're welcome.
You're welcome. Thank you. Anyone else?
Yes. I would like to ask for prayer from everybody who listened in and for Dr. Dolores and you. I'm having surgery in the next 30 days also.
Okay.
And what is your name?
Nina Vodolato.
Nina Velardi. Okay.
Thanks, Nina.
Thanks,
Prayers to you too.
You.
And for those of you who are actually facing coaching, please get in touch with Dr. Dolores, facing surgery. Please get in touch with Dr. Dolores and see what programs she might be able to offer you to help you through the process. One thing that I know more than anything else is when you're facing life's challenges, they're better faced together with someone else rather than going it alone. And knowing that you have someone who understands your situation and can coach you, offer compassionate understanding, anything that, and empower you to be able to go through it from a more, if the word is empowered state, so that you know exactly, you're better off having consulted with her than ending up going through it alone. So I encourage you, info@recoveringhealthcare.com. Dr. Dolores will get your email, or you can call her at 760-579-2440 to connect with her. And be sure to get a copy of her book. What's the name of the book again, Dolores?
It's called Help. How do I get the most out of my healthcare experience?
I love it. And they can get that on your website as well.
That's correct.
Perfect. Okay, so be sure to go to recoveringhealthcare.com. If you want to go to the free webinar at /free-webinar to register for that, the information is on the website. I encourage you, as a transformational life coach, I encourage you to empower yourself to live the best life that you possibly can. Dr. Dolores is a piece in the puzzle that is unfolding on a regular basis throughout our lives. Everybody has their own picture, what your past was, what your present is, what your future will be. For me, I'm better off and doing a better job for myself and those around me when I connect myself to people who are in the know about what I need to know, and that will cause me to have a better experience on what I like to call the transformational trails of life. So until next time, do everything you can in order to be able to empower yourself and to live in a more peaceful state of mind and space of well-being by inviting people like Dr. Dolores Fazzino into your life. And until next time, enjoy those travels. See you next week.